I asked people across New Hampshire to tell me their stories about how the Affordable Care Act has made life-saving difference or otherwise improved their lives. And I've heard from many women across New Hampshire who have written about how the Affordable Care Act has ended discrimination against them by the health insurance industry because of their gender. In particular, they're grateful that the Affordable Care Act includes maternity care and contraception. This is a picture of Maura Fay of Exeter, New Hampshire, and she writes, I quote, "My husband and I are self-employed. Before the ACA, we were paying rates that were simply unsustainable for middle-class families like ours. When I was pregnant in 2013, we were forced to pay a maternity rider of $822 a month. That's an additional to her premium. She says, I'm worried about the rollbacks and regulations around essential health benefits, especially since so many of them impact women. Maternity coverage shouldn't come with an additional $800 a month price tag." Well, I appreciate that letter from Maura, but I'm worried that she may actually be underestimating the cost of maternity care coverage if the Affordable Care Act is repealed. Because according to one analysis, women who seek maternity care under the American Health Care Act, the legislation passed by the House, they could pay up to $17,000 in surcharges to their insurance company. Now, the American Health Care Act that the House passed also makes draconian cuts to Medicaid, and this will disproportionately harm women, nearly 40 million women who make up the majority of Medicaid beneficiaries. You know, Medicaid provides health care for nearly half of all pregnant women in the United States, supporting them through their pregnancies and ensuring that their babies get a healthy start in life. This coverage is directly threatened by the Republican legislation. The American Health Care Act that the House passed, if we combine that with the administration's budget proposal, it would cut Medicaid by a staggering $1.4 trillion by the year 2027. So in 10 years, $1.4 trillion cut. This would reduce Medicaid funding by nearly half and mean that tens of millions of people would lose coverage, including many women of reproductive age. Let me also point out that both the American Health Care Act, passed by the House, and the President's budget terminate all federal funding for Planned Parenthood. And we just heard Senator Blumenthal speak eloquently about the importance of Planned Parenthood. This would leave millions of women and families with fewer health care options. In New Hampshire, it would mean that between 12,000 and 13,000 women and men would lose access to basic primary and preventive health services, including life-saving cancer screenings and HIV testing. According to poll after poll, the American people all across the political spectrum strongly support Planned Parenthood and oppose efforts to defund it. But despite efforts by Republican leaders in the House and Senate to misrepresent the facts, Planned Parenthood does not use taxpayer dollars to fund abortions. Indeed, federal law expressly forbids the use of federal funds to pay for abortions, except under extremely narrow circumstances that have been agreed to by Congress. So the real issue here is not abortion. This is about ensuring that American women have access to the basic health care they need where they want to receive it. Remember that Planned Parenthood plays an especially important role in delivering essential health services to low-income, uninsured, and vulnerable individuals, including in rural areas. Earlier this year, I received a letter from Samantha Fox of Bow, New Hampshire, and she writes, I quote, "In 2007, I was a 19-year-old, just barely starting out when I was denied health insurance due to a pre-existing condition. Had I been able to access affordable coverage, my pre-existing condition, a reproductive system disorder, would have been easily manageable. At that time, I was able to access care through Planned Parenthood, which likely preserved my ability to conceive in the future. She goes on to say, flash forward 10 years. I'm expecting my first child, and I have coverage which, thanks to the Affordable Care Act, includes prenatal care. Now, here in Washington, some people think that repealing the Affordable Care Act is all about politics and notching a win on their scoreboard. But for ordinary people in New Hampshire and across the country, including millions of women, repealing the Affordable Care Act isn't about politics. It's about life and death. We need to listen to the women and men in each of our states whose lives and finances would be turned upside down if the Affordable Care Act is repealed. Furthermore, it's just wrong to exclude women, to exclude their colleagues, to exclude Democrats, to exclude the public, and to pursue a strictly partisan approach to health care. The same approach that produced a terrible bill in the House, and it is deeply misguided to bring legislation to the floor that we all know would hurt tens of millions of Americans and do particular harm to women. There is a better way forward in the Senate. Let's put ideology and partisanship aside. Let's work together. Let's strengthen the elements of the Affordable Care Act that are working in the real world, including Medicaid expansion, and let's fix what's not working. And it doesn't matter what we call this. It doesn't have to be called Obamacare. We can call it whatever we want. The important thing is to have legislation that would provide access to health care for Americans, health care that they can afford, that is quality, that is there when people need it. This is what the great majority of the American people want us to do. It is time now to respect their wishes. Let's strengthen the Affordable Care Act so that it works even better for all Americans. Thank you, Mr. President. I yield the floor.